Have you considered that your diet might be the cause of recurring candidiasis? Does the anti-candida diet really work? Did you know that we all have a fungus called candida in our bodies? Could it become problematic when it over-reproduces? If you're experiencing uncomfortable symptoms such as discharge, urinary infections, itching, or discomfort, and you're unsure of their origin, candidiasis might be the culprit. In this video, you'll learn everything about candida infections, what they are, the different types, and whether you're at risk of contracting them. Most importantly, discover how to protect yourself, including natural options. But before we delve into that, please like, subscribe to the channel, and hit the notification bell to stay updated on our upcoming videos. Also, share this information with your friends and family. Candida is a yeast, a type of fungus that naturally resides in the body, on the skin, in the mouth, in the digestive tract, and in the reproductive organs. In small quantities, this is normal and doesn't cause problems. Our immune system, along with the bacteria living within us, keeps the fungi in check. However, certain conditions can make your body more susceptible to the excessive and uncontrolled growth of candida. So, when do conditions become favorable for the overgrowth of candida? When you disrupt this balance due to a weakened immune system and damage the intestinal flora, killing the good bacteria and allowing fungi to multiply. Therefore, it's crucial to prevent candida from infecting you by maintaining a balanced body, a strong immune system, and a healthy flora working in your favor. Without this, candida will take advantage and an infection becomes likely. So, who is at a higher risk of developing candidiasis? First, people with a weakened immune system, those undergoing chemotherapy or radiation therapy, using corticosteroids, having undergone transplants, having autoimmune diseases, AIDS, or primary immunodeficiency, or those who have been hospitalized in critical condition. The good news is that even in these cases, the infection can be efficiently treated or prevented, and once the immune deficiency is corrected, the fungi disappear. The second and quite common risk factor is the use of antibiotics. Antibiotics kill harmful bacteria causing infections like sinusitis, tonsillitis, pneumonia, but they also kill the good bacteria in our intestines and on our skin, allowing candida to multiply. There's not much method here. If antibiotics are prescribed, take them. Just don't take them unnecessarily. The third is uncontrolled diabetes. Many people don't know they have diabetes and continue to experience recurrent urinary tract infections, onychomycosis, oral candidiasis, genital itching, and persistent discharge. It could be diabetes. Candida is a fungus that loves sugar. Remember that. If you have recurring candidiasis, see your doctor or visit a health center for a blood test. Basically, your fasting blood sugar and your glycated hemoglobin, which is the average of your blood sugar over the last 10 weeks. The fourth is medication. Thinking about diabetes, there's a class of diabetes medications that are excellent, which can treat heart failure, aid in weight loss, but when you urinate with sugar, the glucose in the urine can act as a nutrient for candidiasis. It can cause urinary tract infections, genital itching, pain during urination, and swelling in the genital organs. So if you're using this type of medication, make sure you're clean. If a drop of urine remains, it can cause balanitis in men, swelling, painful foreskin, and in women, there's burning and pain. Well, the good news is that some people only experience 1 or 2 outbreaks of infection when they start taking these medications. After that, the body adapts, glucose is better controlled, and the fungus disappears. If the infection reoccurs, the only solution may be to replace the medication. Other treatments include the use of inhaled corticosteroids for respiratory conditions, which also increase the risk of oral candidiasis. They don't weaken the overall immune system like intravenous or oral corticosteroids do, but if left in prolonged contact with the tongue and cheek, they can suppress the local immune response, causing oral candidiasis. But don't worry. In this case, the problem can be avoided with 2 actions. Using a spacer directs the medication to the lungs and, at the same time, reduces the amount of medication that remains in the mouth. And also, very importantly, after each dose, rinse your mouth with water and brush your teeth, tongue, and cheeks. Reason 5. Using dental implants or other devices inside the mouth, like those that prevent snoring, also increases the chance of developing candidiasis in that area. Again, maintaining cleanliness will help prevent fungal growth. The 6th reason is the use of tight and wet clothes. Some people like to wear a bikini all day, but did you know that this increases the risk of contracting vaginal candidiasis? When you stop being wet, take a shower and wear dry clothes. Reason 7. Improper intimate hygiene. Factors such as excessive use of soaps and hygiene products can alter the pH of the vagina, leading to the overgrowth of candida. It is recommended to wash the area with water and mild soap, avoiding perfumed products and sponges. It's also crucial to thoroughly dry the genital area after a shower. 8th reason. Pregnancy. Vaginal candidiasis is more common during pregnancy due to hormonal changes in a woman's body. During pregnancy, estrogen levels increase, which can alter the balance of the vaginal flora and create an environment favorable to the growth of candida. Additionally, increased blood sugar during pregnancy can contribute to the development of candidiasis. The 9th reason is sexual intercourse. Pay attention because this topic generates a lot of controversy. Candidiasis is not considered a sexually transmitted infection, but it can be transmitted through sexual contact if one of the partners has an active infection. And the 10th place is chronic stress. Chronic and severe stress reduces immunity and supports the multiplication of candida. What are the most common locations for candidiasis? In the mouth, oral candidiasis, also known as thrush, causes very typical lesions, white or yellowish and sticky, that appear on the tongue and cheeks. Another location is the throat. Sometimes a person who had oral candidiasis progresses to the pharynx and esophagus, causing more severe symptoms such as pain when swallowing and drinking water. Sometimes a person becomes dehydrated and needs hospitalization. But it can also occur on the skin. Cutaneous candidiasis. Symptoms include a red, itchy, scaly, and painful skin rash. Cutaneous candidiasis can occur in warm and humid areas of the body, such as the groin, armpit, under the breasts, and in abdominal folds. Diaper dermatitis is a common form of cutaneous candidiasis in babies. Nails. Nail candidiasis symptoms include deformation, discoloration, thickening, and breaking of the nails. In the genitals, genital candidiasis can affect both men and women. In women, it is more common and appears as itching, redness, and swelling in both the vulva and vagina, along with a thick, white vaginal discharge that looks curd-like and is odorless. Men may also experience a burning sensation, especially during urination or sexual intercourse. In more severe cases, such as in burn patients and those with intravenous catheters, candida can enter the bloodstream, reaching the heart valve, causing endocarditis, cerebral meningitis, or even systemic infection, leading to death. The mortality rate can reach 45%. How to prevent candidiasis? First, does the anti-candida regimen work? This diet has gained popularity in the United States and is based on the belief of some experts. They observed that an increase in sugar leads to fungal growth. So they advised cutting out sugar, refined flour, anything that alters intestinal flora, which, as mentioned, could contribute to candida proliferation, in addition to reducing yeast consumption. In return, they recommended a low-carbohydrate diet with more vegetables, seeds, and low-glycemic fruits. However, studies have not proven that this diet reduces candida infections. It's more speculative. Another factor to address is stress. We know that stress can unbalance our bodies and make them vulnerable to candidiasis. Combat it with activities such as exercise, meditation, and nurturing friendships. But that's not all. Maintaining a strong immune system is also crucial to preventing candidiasis. This includes things like proper sun exposure to get vitamin D. Some natural remedies have been suggested to prevent and treat candidiasis. Scientific evidence on the effectiveness of these treatments is still limited. What are they? Tea tree oil has antifungal and anti-inflammatory properties, especially beneficial for nail fungi. Garlic garlic contains natural antifungal and antibacterial properties and may help reduce candidiasis symptoms. Yogurt containing lactobacillus helps prevent excessive candida growth. Some studies suggest that probiotics may prevent recurrent vaginal candidiasis by creating an acidic environment inhibiting fungal growth. Additionally, lactobacillus can reduce inflammation and improve the local immune response. Propolis. Propolis is a natural product with numerous antimicrobial properties. A 2009 study showed that topically applying a propolis solution was effective in treating oral candidiasis in HIV patients. You can incorporate these simple changes into your daily routine and avoid yeast infections. And the treatment? The treatment of candida infections depends on the type and severity of the infection as well as the patient's risk factors. Treatment may include addressing risk factors, topical medications, oral tablets, or even intravenous antifungals for severe infections. Treating vaginal candidiasis during pregnancy requires caution and supervision by a doctor due to potential risks for both mother and child. There is no evidence that treating an asymptomatic partner is necessary for recurrent vaginal candidiasis. This is because recurrent vaginal candidiasis is usually caused by changes in vaginal flora balance and individual risk factors for women. However, in rare cases where a sexual partner shows symptoms of candidiasis, treatment with topical or oral antifungals may be necessary to prevent reinfection of the partner. When a woman experiences 3 or more episodes of genital candidiasis in a year, it is termed recurrent vaginal candidiasis. It is usually caused by a combination of risk factors, and treatment should be based on identifying and correcting these factors. If the problem persists, preventive treatment is an option. Remember that prolonged use of oral antifungals may be associated with side effects such as liver damage and drug interactions. Additionally, excessive use of oral antifungals may increase the risk of developing drug resistance, making future treatment more challenging. Your doctor can help determine the best treatment option for you and your specific condition. Well, I hope you enjoyed the video and learned a lot about candida infections. Remember to share this information so more people can benefit from it. Until the next video.